Hello friends, in this video we are going to learn about adrenergic and antiadrenergic drugs. As we all know that when our body goes into excitatory phase, like we are performing any kind of physical activity, then our body or we can say our brain triggers a system or pathway, that is adrenergic system, through which it secretes a chemical like adrenaline and noradrenaline, represented as ADR and NA. So in this video we are going to learn about the synthesis of this adrenaline, their storage and metabolism of this adrenaline, how it performs their action. Then we will go through adrenergic receptors and actions, classification and the uses of this kind of drugs. Like adrenergic drugs we will discuss first, then anti-adrenergic drugs. Alright, so let's begin one by one. First one is adrenergic drugs. So before proceeding further, we must know that this adrenergic transmission is restricted to sympathetic action. So whatever the action we will get through adrenergic transmission of signal, that will be sympathetic action. There are actually three types of chemical involved in this pathway, adrenergic pathway. First one is noradrenaline, second is adrenaline, third is dopamine, and all these three in combined called it as a catecholamines, represented as Ca. Alright, so let us look at this picture. We have drawn a synaptic cleft, a junction between the two neurons where actually the signal is transmitted through this chemical, and this chemical is stored in these blue bubbles. We have to understand how this gets synthesized. So first of all, the amino acid called as phenylalanine that get converted into tyrosine, and this tyrosine get converted into dopa. This reaction is occurred inside a liver. After that it goes to neuron, wherein this dopa get converted into dopamine, and dopamine get converted into noradrenaline, and noradrenaline produces adrenaline. That is the final chemical. Alright, so this pathway we can understand through this picture as well. Just have a look. Okay, so till now we haven't mentioned the enzyme that are involved in this reaction. Like first reaction and second reaction is carried out under the presence of hydrolase enzyme, and we had mentioned this occurs inside a liver. Then dopa to dopamine conversion takes place in the presence of decarboxylase enzyme, and dopamine get converted into noradrenaline by beta hydrolase enzyme. And the conversion of noradrenaline to adrenaline takes place inside a renal gland through an enzyme called N-methyl transferase, and rest of the reaction occurs inside a neuron, liver, neuron, then renal glands. Okay, so once it has got synthesized, this noradrenaline is stored in synaptic vesicles, or we can say granules, within the adrenergic nerve terminals. So once it gets synthesized, it's stored inside a blue bubbles, which we had already shown in the previous image. Here also I have drawn this, so just have a look. In this blue bubble it gets stored. The nerve impulse coupled release of catecholamines takes place by exocytosis via calcium channel. Yes, whenever there is an influx of calcium inside this vesicle, inside this blue bubbles, it get contract, and due to which there is a leakage of this chemical adrenaline, noradrenaline, dopamine. Therefore it produces an action. Once it get released into synapse, their metabolism is carried out by two kinds of enzyme, that is MAO and COMT. Once it perform its activity, it get cleaved out in a synaptic cleft by two enzymes MAO and COMT, which causes the cleavage or breakdown of these chemicals. And the rest of the enzymes, what will happen with them? Rest of the noradrenaline is recaptured into these blue bubbles, which we call it as a synaptic bubbles, through sodium and noradrenaline coupled mechanism called axonal uptake, and that get stored into the synaptic vesicles back to its normal stage. Alright, so we have to understand the receptors as well, where it produces its action. Actually there are two kinds of receptors, alpha receptors and beta receptors, and both of these receptors are GPCR kinds of receptor. Okay, these are further classified as alpha 1, alpha 2. Alright, similarly beta 1, beta 2 and beta 3. So we have already mentioned that it is GPCR kind of receptors that regulates that regulates potassium and calcium channel influx. Therefore, it causes either contraction or relaxation of any kind of tissue. So through this diagram, we will understand the location. Beta 1 is present in heart, beta 2 in lungs, and beta 3, let's write it down at the bottom. It is present in adipose tissue. So beta 1 in heart, beta 2 in lungs, and this beta 3 that is in adipose tissue or fatty tissue we can say. Alpha 1 that is in blood vessels, and alpha 2 that is present in nerve endings inside a brain, inside pancreas. There is no significant use of this alpha 2 receptors, and whatever the action which we are getting through this process, that is sympathomimetic action, or in other words we can say parasympatholytic action. Lytic means opposite to that of parasympathetic action, means sympathomimetic action. Furthermore, we will discuss its action in eyes. It will produce mydriasis. So mydriasis occurs due to contraction of iris. What does it cause? It causes contraction of iris. Therefore, intraocular tension tends to fall, especially in wide angle glaucoma. So we can say it can be used in glaucoma. And just keep in mind one thing, that the action are related to excitatory stage of our body, like whenever we are in anger, like that we can assume. So second is blood vessels. Whenever we are in anger, there will be rise in blood pressure due to vasoconstriction through alpha receptors, and similarly there will be vasodilatory action as well in skeletal muscles, liver and coronaries. So it will have both action, vasoconstriction and vasodilation. Alright, so third effect or third action will be on heart and blood pressure. We have already mentioned earlier, through beta 1 receptor. We know beta 1 receptor is present in heart, where it causes blood pressure to rise. It also increases heart rate, force of contraction, like that. And in respiration, through beta 2 receptor, we know that beta 2 receptor is in lungs, so it will cause bronchodilatory effect over there. And the last one, it will also have some effect in smooth muscle like GIT, urinary bladder and uterus. In GIT, it will cause relaxation. It reduces peristaltic movement. In bladder, it will hinder the micturition, and in uterus, it will have both effect, like relaxation and contraction, depending on this situation of uterus, like pregnant, non-pregnant, like that. Alright, so next process or next step is we have to understand its classification with applications. First class is pressure agents. Example is noradrenaline, dopamine, ephedrine and phenylephrine. Second, it is used as a cardiac stimulant. Example is adrenaline. It is also used as bronchodilator. We had discussed in my previous slide. Example of these drugs are salbutamol, salmeterol and formoterol. And these drugs are generally used as anti-asthmatic drugs, bronchodilators. Okay, pressure agents, cardiac stimulants and bronchodilators. Means we can consider as a blood vessel, heart and lungs. Fourth one is a nasal decongestant. Example is phenylephrine, pseudoephedrine, oxymetazoline and xylometazoline. So in the market there are so many nasal sprays are available, and we can often find this kind of drugs over there: pseudoephedrine, oxymetazoline and xylometazoline. Fifth one is CNS stimulant. Example is amphetamine, that triggers our brain to increase the memory and alertness as well. Sixth one is uterine relaxant and vasodilators. Examples are ritodrine, salbutamol and terbutaline. So these are generally used in case of childbirth as well, ritodrine and all. They are uterine relaxant. Pressure agents: cardiac, broncho, nose, nasal, CNS, brain and uterus. Like that we can remember this. Next is antiadrenergic drugs. We have to keep in mind that whatever action we have discussed till now, here the action will be totally opposites. So first we will go through the classification of antiadrenergic drugs, and these drugs are nothing but blockers. It will block alpha and beta receptors, means it will produce a totally opposite action. So first one, its classification as a alpha adrenergic blockers. We know that there are two types of alpha receptors, alpha 1 and alpha 2. So first class is non-selective blockers that will cause alpha 1 and alpha 2 both. Example is ergot alkaloids, and imidazoline. Second is selective blocker. So alpha 1 selective blocker is like prazosin, terazosin, doxazosin, so zosin class of drugs. Alpha 2 selective blocker example is yohimbine. As I had already mentioned, there is no significant use of this drug yohimbine, alpha 2 selective blocker. And second class is beta adrenergic blockers. Now there are two classes like non-selective and selective. Under non-selective, it will cause blockage of beta 1, beta 2, beta 3. Like example is propranolol and sotalol. Beta 2 is cardioselective beta 1 blocker like atenolol and metoprolol that specifically block beta 1 receptor. So that is how it blocks, that is how it dilates blood vessel and also reduces the force of contraction of our heart and produces hypotension. So this way we can say that this kind of drug are generally used in hypertension, right? And one more third class is there like alpha and beta blockers. Both they block. Example is labetalol and carvedilol. It blocks blood vessel as well to cause a dilatation, and it causes blockage of beta 1 receptor as well to cause to reduce the force of contraction, heart rate, blood pressure. Okay, so it is used in hypertension, we can say over here. And the last part of this video is action and application. In the eyes, we have to discuss that. Before that, I must tell that there it was excitatory action. So here we are discussing action to reduce the, or it will have the lowering of excitement like that action. In eyes, it will cause non-selective beta blockers reduces IOT, intraocular tension, by reducing aqueous humor secretion. Example, timolol. So timolol, we often heard that it is used for glaucoma. Second, in CVS, cardiovascular system, of course it will reduces blood pressure, force of contraction, heart rate, and also it will cause blood vessels to dilate, and that is how it reduces the blood pressure and used in hypertension. And third, in respiratory tract, yes, caution has to be taken. Caution is taken for asthmatic patient. For example, propranolol, that is a kind of non-selective beta blocker that can cause a blockade of beta 1, beta 2, beta 3, increases bronchial resistance by blocking beta 2 receptor. So it has to be avoided, or caution has to be taken whenever we are giving such antihypertensive drugs to asthmatic patient, which acts on these beta receptors. And there is no significant use in CNS, skeletal muscle, and uterus, so we are not discussing that over here. There are three major applications: eye, CVS, and respiratory tracts. And major application till now we have discussed, that is in heart only, as a antihypertensive, angina, cardiac arrhythmia, myocardial infarction, CHF, and glaucoma. Thank you for watching this video.